Hi everyone, I'm Melanie Grant, and this is part 2 of our 2030 Learning Module 2 on C&M Glass. Okay, so a little bit about HCPCS. This is chapter 30 in our McGraw-Connect information, and we're going to be talking about the DME, POS, and transportation, and what that stands for. Okay, so the first thing is durable medical equipment. This is all of the equipment that a patient is given when they leave a doctor's office, such as splints and boots, cast, medical beds if they're sent to the if they're ordered and sent to the patient's home. There's various companies out there that a patient can go in with a prescription for a specific item, such as a reclining chair that lifts them up because they have trouble getting up. These are all part of the durable medical equipment and have some really cool looking things in there. If you've never had a chance to go into a DME store, take a look on the internet. They're pretty neat. I like seeing some of the things, including like compression stockings and all the various services that a patient can get a prescription for and go in and purchase under their insurance plan. Prosthetics and orthotics, and then also supplies. And so we're going to talk more about some of the ones that relate to medicine section and an overview right now. However, as we go forward in some of our other sections with CPT, we're going to revisit some of these sections here in HCPCS. So as we go through it, you'll find that the HCPCS coding is a lot easier. It's fairly straightforward, and we'll revisit several times throughout the term. Okay, so we just got done talking about medicine. One thing we didn't talk about in detail, though, is injections. So any type of injection, when we have a specific reason for an injection or infusion or chemotherapy, anything that involves a medication or a drug, there's going to be 2 codes assigned for that service. The service itself, which is the doing, the administration, and there's a hierarchy to that you'll learn all about in the medicine section when you watch the video that's presented in the instructor folder. Besides the CPT code for how we gave it, we also have what did we give, which falls under HCPCS for our drugs and chemicals. And this is something I was starting to talk about in the last video. So I wanted to give you guys a little bit of detail on this. There is in the alphabetical section all the drugs by most of the time their generic name or well-known name. So you can look up a drug or chemical by those names, or you can go into the table of drugs and look it up here. I like using the table of drugs because it's pretty straightforward and across. You don't have to flip back and forth. But sometimes there's also information found in the J-code section that's important to look at, such as brand names and also known as. So if you're not finding everything matching the drug you're wanting, it's important to look in the J-codes to verify that drug. Okay, so in the drugs and chemicals table, you have your drug name, separated by dosage and method of administration. And then finally, your code. Okay, so we have a couple of really cool breakdowns here. We have our drug name. We'll just fix that in a second. The route that it is given based off of the billing. We'll talk about that more in detail here in a moment. The method and the code that relates to that. Okay. There we go. Kind of give us some details here. I'm going to give you guys a couple of codes here. Okay, so if you look in your drugs and chemicals, table of drugs and chemicals, and we're just going to start with the A's. We have the first one here is ANSEF. Okay, and it's broken out as 500 milligrams for your dosage. It can be administered by IV, which is intravenous, or IM, which is intramuscular. And so that IV or IM is going to have a CPT code that says intravenous injection or intramuscular injection. And sometimes it'll be broken down by a first or additional injection that was given. And then you have the code J0690. Okay. Our next one, we have Atteres 9040. or 90-4, sorry about that. Okay, its dosage is by 1 milligram, so it's something that's not necessarily a high dosage. It's only done by intramuscular, and it's with code J3121. Now, what do I do if I have a provider that documented giving address 90-4 by intravenous when it's only available intramuscular? I need to go and verify what drug was actually given in case there was an error, and maybe they meant something similar, and I need to also verify the route and administration and everything else. This is a good point to keep in mind. If something doesn't match how it's given, there may be a moment for query to the provider to verify the information correct. Okay, the next one down the list is Andro-CYP. It's also a 1 milligram, and this one doesn't list any kind of method of administration, which means that it's open. Okay, J1071. Notice how when I write my zeros, I should be writing little dashes in each of my zeros to identify the difference between an O and a 0. Make sure that when you're writing these down, you always do that. And when you speak it out loud, never say J-O or J10. You want to speak 0 for the purposes of alphanumeric coding and not having anybody confused in the instance where somebody's writing down what you're stating. Okay, and then the last one we have is another type of andro, CYP 200. And oftentimes you'll see this where a drug is given in different types of dosages, and for that reason the dosage itself here is the same at 1 milligram, and there's no method of administration listed here, but sometimes the doctors or the pharmacies may indicate the pharmaceutical as a different name based off of the mixture that it is. So in this case, the code itself is the same, but to find it, we want to make sure to review based off of the name that was given. Okay, so now that we have our drugs and chemicals table, it's a very simple task of finding the drug that you have based off of the name or generic name. Sometimes it's important to look up that name, and if you're ever not certain, you can go to the PDR.net and search drugs names for generic and brand names, as well as details about how it comes. This is a really great resource, physician's drug reference. It's something that you should have already looked at in some of your previous classes, and it is highly suggested that you have this page marked, put it in a safe file, because when you're done with this class, you won't have the references, and this is something I really want you to have as a coder in the real world. Okay, so make sure to go to pdr.net, look up any drugs that you're unfamiliar with. This will give you also indications that you might need for diagnostic coding if you're saying the patient's been on a drug for a long time, to know what type of drug that classifies as, because that's a very important factor. Or even when we get into E&M coding and we talk about controlled substances and identifying, is this a controlled substance? The PDR.net is a great resource for this. Okay, so then moving on, we have our drug that's given to us. We have the name that the provider will say. So let's say they said provided Ancef at a 500 milligrams per ml IV, 3 mLs given. Now I'm giving you guys a math problem because this is very important. Oftentimes the dosage that is available for this drug will not be billable, will not be the same as what was given. So patients are constantly needing different drugs, dosages and amounts based off of their needs and their medical conditions and their previous history. It's our job as coders to build those drugs based off of how the dosage is and what was given to us. And so this is a common one you'll see where they'll give us the drug name. They'll say the amount that was per ml, and it'll be a dash like this, was given by IV. And they'll also give you things like drip, push, first hour. So those are things that'll talk about into your CPT code as to, is this an IV push or an IV injection? You know, how was it given? Okay, so that part's not important here. What you want to know is what was given, how much, and in what dosage it was given, and then what was the overall amount. Okay, so here we have an easy category because it's 500 milligrams, and the 500 milligrams here matches and is the same. That may not always be the case. Sometimes you have to convert, they'll say 250 milligrams per ml, and then you have to say, okay, well 250 is half of 500, so for every 2 of these, 2 mLs is 1 dosage. Does that make sense? If not, I'm going to give you guys some practice. So don't let this scare you. This is the most involved math that you will see with medical coding. Okay? So here we have our example, 500 milligrams per ml when 3 mLs were given. So what we have to say is, does this match the dosage? It does. In that case, every single ml is equal to 1 dosage. So I would bill J0690 times 3. To indicate 500 milligrams per ml when 3 mLs were given. Okay? Now I'm going to erase the PDR.net reference. If you haven't written that down yet, go ahead and look in your medical references that you have in your Blackboard. I'll put this as one of the links in your references for this week. Okay? So let's do one more, and then that'll be all for us today in this video. We're going to take the same concept of ANSEF, and this time, instead of saying that the dosage matched, we're going to say the provider said ANSEF was given at 250 milligrams per ml, and a total of, let's say, 6 mLs were given. Okay, this seems like some basic math. It can get more complicated as you go. So the important thing is to take it just one step at a time. It's always the same process. The first thing is to say, does the dosage given match the dosage that it's billable by? In this case, no, it does not. So you have to say 250 is equal to half of 1 dose, or 2 mLs equals 1 dose. If that makes it easier, makes more sense to you. So then you just take this number here, how much total was given, and you say 6 divided by 2, because I choose to go with this method, equals 3. So I'm going to say 3 doses. And this is actually the same as over here. So then I'm going to bill J0690 times 3 for both of these scenarios when 6 mLs are given of a 250 milligram per ml solution. All right, that's all for today. I'll go ahead and for those of you that have any difficulties with medications, I can provide a little like breakdown for pharmaceuticals, but that's it for today. Make sure you read through all of the assignments that are given and focus on your chapters 20, what were we on, 28 and 30, which were assigned in your Connect and your workbook assignments this week. Make sure also to work on those each week, because even though the hard due date is not till February 11th, the idea is to give you time to practice those and get ready. Have a great week, guys, and we'll talk to you next time.